Thank you, Nikki. I'm here today with Professor Jerry, an expert in the RosenhanStudy. Professor Jerry, can you tell us more about the details and results of this study?
Of course. The RosenhanStudy was originally done to explore whether or not mental professionals could actually truly identify mental illnesses. Thus, 8 volunteers faked signs of hearing voices and admitted themselves into 12 different mental facilities across the nation with the diagnosis of schizophrenia. On admittance, the pseudo-patients stopped all symptoms and behaved normally. While we might go on about how not one of the pseudo-patients was identified, the bigger issue seen was the observed treatment of hospital patients.
What do you mean?
Well, each pseudo-patient took anywhere from 7 to 52 days to be released, and during their stays they recorded their treatment and observations, as well as pre-decided sub-experiments. One experiment, for example, involved pseudo-patients asking normal questions to passing hospital staff like, "How are you?" or "Do you know when I will be released?" etc. 71% of the time, psychiatrists were found to not even acknowledge the patient, while nurses' attendants were even worse with 88%. Even if the pseudo-patient was acknowledged, oftentimes the question itself was ignored. Overall, very little humanistic contact was given to patients, though there was no shortage of drugs given. Of the 8 participants, a total of 2,100 pills were given.
And we think schools have a drug problem. But what exactly is the effect of such a treatment?
What Rosenhan observed was a process called dehumanization, in which hospital professionals simply didn't consider the patients to be real people. Many pseudo-patients themselves expressed distress at the lack of social acknowledgement, not to even mention positive social interaction. Hospital staff had learned to generalize patients based off of their mental illness, attributing all behavior to being a manifestation of their illness. Reading a book could be seen as antisocial behavior, while wanting to eat lunch early could be an oral fixation. In the end, mental hospitals and care facilities in general were given a huge wake-up call on how they should be treating their patients.
Thank you, Professor Jerry. Back to you, Nikki.